My name is Vincent Hochstetter. I'm a licensed clinical social worker here at Central County Services. In today's Mental Health Minute, I wanted to talk to you guys about what's the difference between mental illness and mental health. Mental illness and mental health are two terms that are often interchanged with each other that mean two different things. What is the difference between the two terms? And hopefully it will help provide some insight on how to use these two terms when you're discussing with your primary care physician or with a provider here at Central County Services. Mental health is a concept that is often used when describing one's overarching wellness of their psychological and emotional well-being. How one individual deals with their daily stressors and how the individual processes their emotions. Mental illness, on the other hand, is the disruption of one's psychological and emotional well-being. It is the inability to be able to process their daily stressors, and it often coincides with a chemical imbalance, which is usually diagnosable and treatable. I would like to talk about 5 signs and symptoms that may indicate mental illness. First, long-lasting irritability and sadness. These signs and symptoms can be part of normal life. However, when it goes on for a lengthy period of time, it should raise some concern. Number 2, extreme changes in moods, whether that's high moods or low moods. Anytime an individual fluctuates between moods, this should be a sign that something that may not be right in their life and they may need an assessment. And if there is ever a disruption in one's sleep or in their eating habits, this is also a key sign of mental illness. Next is excessive worry, anxiety, and paranoia. All of these can be indicative of mental illness alone, but when together, the chances of mental illness increase. Last but not least would be social withdrawal. Withdrawing from preferred activities, withdrawing from friends and family, isolation, all of these are signs of mental illness. Here at Central County Services, we're fully aware that the coronavirus pandemic has impacted our communities, impacted our households, and impacted our loved ones. We're here to let you know that Central Counties isn't going anywhere. We have the staff, the knowledge, and the services to help any individual regain control of their mental illness. I hope what I've explained will help communicate the difference between mental health and mental illness when you're talking with your provider and prescribers. And I hope you tune in next week for next week's Mental Health Minute.